So let's talk about Cefepime and Enmetazobactum in the next 5 minutes. So this is a combination of a beta-lactam, which is Cefepime in this case, which is a 4th generation cephalosporin, and a beta-lactamase inhibitor by the name of Enmetazobactum. So this is a newer beta-lactamase inhibitor drug in the market. So what does a beta-lactamase inhibitor do? It suppresses the beta-lactamase enzyme, which is produced by the bacteria, and thus it protects the beta-lactam. Thus it protects the beta-lactam from getting hydrolyzed and allows to do its function. In this case, the beta-lactam is Cefepime and the beta-lactamase inhibitor is Enmetazobactum. So the combination, and especially the Enmetazobactum, is very effective in suppressing the extended spectrum beta-lactamase enzymes. Examples are SHV, CTXM and TEM. However, this is less active, this beta-lactamase inhibitor, against the beta-lactamase enzyme AMCs. But still, the drug acts on AMCs. This is because the beta-lactam Cefepime has good intrinsic or inherent activity on AMC, and thus the combination is also effective on AMC. It is also effective for ESBLs. So before this drug was available, what was the drug of choice for treating organisms producing these beta-lactamases? So it was a carbapenem, especially in severe infections. Otherwise, a previous beta-lactamase inhibitor, Enmetazobactum, could have been used if the infection is less severe. However, with the advent of these combinations with Enmetazobactum, these bacteria can be treated almost as good as a carbapenem by Cefepime and Enmetazobactum combination, and hence we say that these drugs have a carbapenem sparing property. So this combination is better than Enmetazobactum or 3rd generation cephalosporin ceftazidime or the 4th generation cephalosporin Cefepime alone. Mind it, without EMT on organisms producing these enzymes, and the effect is almost as good as the carbapenem meropenem. So is there a evidence for this? Yeah, there is evidence by way of many clinical trials. The most important was the Allium clinical trial published in JAMA, in which this drug was compared with the age-old BLBLI peptidase for complicated UTI, and what they found that it performed better. There were better cure rates, there were better microbiological improvement rates as compared to peptides. But you need to remember that do not use these drugs for organisms producing carbapenem resistance enzymes or for Enterobacteriaceae which are resistant to carbapenem. Examples of these enzymes are KPC, metallobeta-lactamase or OXA48. Sometimes Enmetazobactum can inhibit OXA48 as it appears, but this is inconsistent, and the activity shown by the combination over OXA48 may be because of intrinsic activity of Cefepime. So always look for the sensitivity report before using this drug for a organism which is producing carbapenem resistance. Otherwise, don't use it. Also, don't use these enzymes for extensively drug-resistant Pseudomonas, for Serratia, as studies have shown that this is not effective over Serratia, and also for one more important bug, Acinetobacter. This won't be effective on Acinetobacter. So that's it for Cefepime and Enmetazobactum. Thank you.